Good morning.
Good
Good
morning. Good
morning.
morning.
Here I am
Here I
with
am with
Dr. Tolulope Olabintan, and I'm so thrilled to have her here.
here.
This is Dr.
This is
Sarah
Dr.
Merritt
Sarah
from
Merritt from
Livingspring Health
Livingspring
Center.
Health Center.
We're here to
We're here to
educate folks
educate
on chronic
folks on
pain
chronic
and
pain
wellness,
and
how to
wellness, how to
live a better life.
live a better
And
life. And
Dr. Tolu is a
Dr.
good
Tolu
friend
is
of
a good
mine.
friend of mine.
She's an expert
He's
at
an
the Facebook
expert at
Live.
the Facebook
She has a practice in Texas,
in
and she's going to
Texas,
tell us
and
all
she's
about
going
it.
to tell us all about it.
Oh, awesome. Thank you so much, Dr. Sarah, for having me on, talking about something that's so dear to my heart. So I'm so happy to be here. Like you said, I'm Dr. Olabintan, and I'm a family medicine doctor. We have a practice, Livingspring Family Medical Center in Mansfield, Texas, not too far from Dallas. And there we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. So if you know anyone in the area, send them our way.
No, and I think that really works
And I think
with
that really works
my philosophy also, because a lot of
also
pain
because
management
a
is
lot of
really a quality of
management is
life
really
question, right?
Mhm.
That if a
right. That
patient has significant chronic pain,
uh,
better pain treatment can help them live a
live
better
a better
quality of
quality
life
of life
in their
in their
situation, and
situation, and
it's huge for us. And so, Dr. Tolu, I'm cutting out here. Dr. Tolu, what are the things that you do in your practice to help people live a better quality of life?
So before we go ahead with the tips that I tell to
Yeah.
patients, I kind of try to sell them in on the why.
Mhm.
And so it's more what's important to you, where you see yourself in 5 years, what do you want to be doing in 5 years or so. Then we tailor that to, well, these are the things that are known to help improve the chance or increase the chances of you getting there and you enjoying what you're doing in the best shape possible, even given your health conditions. And so once you have people sold on their why, then it's something they are eager to participate in. So it's not me, you should do this, I'm your doctor, thou shalt do this. It's more, well, what's important for you? Well, these are the things that we know based on data, based on science, that you should do to help increase the chances of you living long and well. And that's quantity and quality of life.
Yeah, so really making sure that the
really
patient
making sure that the
understands
patient
where they want to
understands
be
where
and,
they
and
want
how
to
they
be
can get
and
there
how they can
with
get
the help of
there
their
with the
doctor.
help of their doctor.
And I think that really
And
falls
I
on
think that
the
really
role of
falls
the
on the
relationship,
role of
right? The doctor-patient relationship that, like you said, it's not just, hey, you should do this because I said so, but because we understand each other, let me work with you to get where you want to be.
Mm, mm. It's a partnership. And I'll be honest with you, I've had to learn through the interactions with patients that that's more effective. Because I mean, we're trained usually, this is what you do. But the truth is the outcome is heavily dependent on the patient, heavily
Yes.
dependent. And so it becomes an onus on us as physicians to continue to empower patients and tell them this is why you should do it. And these are strong suggestions for you. And this is why you should do it because this is important to you. At least you say this is important to you. Even in patients that have the most dire potential outcomes, there's something they're usually looking forward to, traveling or spending time like, well, we can help make that possible by trying these things.
Well, and sometimes those outcomes, those everyday actions to a big outcome, those feel very separate, right? Like what I eat for lunch, does it determine me getting to travel? And I think that's some of the disconnect, right? It's very hard to recognize that in our day-to-day actions, how these little habits, little daily actions are really building the future.
And sometimes they stumble on it, or they actually, like I had a patient who was doing a Daniel's fast. So with that, you're eating mostly like plant-based
Yes.
diet. And when I saw her, I said, how do you feel? She's like, what do you mean? I said, pain scores. And she's like, you know what? Actually, my hips hurt less when I ate better. I felt more energy. I slept well. I'm like, there you have it. Like, it's not coincidental.
Yes.
It's what you eat. And she's like, yeah, I'm going to try and see if I can stick to that for the most part. So, you may not feel it the next day, but those little small actions over time, you see the effect. And when you look back, you're like, wow, I'm actually getting better.
Yes. And I think that idea that those little actions add up and taking a moment to reflect is probably how you see patients notice it. Is that right?
Yes, I have to tell them like, what did you like? How they're like, oh, I feel better. I'm like,
Yeah.
because if you don't know you're making progress, then it's you're not sometimes encouraged or empowered to continue. So I tell them, no, specifically, how do you feel better? I don't want you to tell me what you think I want to hear. Like, tell me the things you've noticed when it comes to your sleep. She's like, oh, you know what, and I'm like, there you go. So I want you to remember that for the next time you're about to get up and go exercise and you're like, I don't want to do it. Remember the outcomes and see that's enough to get you out of the bed.
And like with your clinical approach, do you make time for this in a well visit, for a sick visit? You're going to address these issues with patients. What's your approach?
So the wellness visit is a good time to kind of hone in on these, but I have some patients who don't like coming to see the doctors unless they have to, so they're sick. So that's a good time to say, oh, by the way, your lab 6 months ago. Here we go. And I'm like, yeah, I don't know what next I'm going to see, so I want to make the most of today. Cholesterol is not so good here. And one of the things I'm trying to do is try to write things down and say or send links so that way people have it with them as opposed to maybe giving them a piece of paper. But every opportunity, there's one little nugget I try to tag on to the visit. Yes.
Yeah. And do you give them? You said not to be away from paper.
Yeah, I'm trying to stay away from paper. Some do. Like my older patients have me to write it down. For my younger folks, I just tell them, you know what? Here's a link to a nutrition based program online. It's free. Go ahead and sign up and follow through. Or I'll send them a link to like a Facebook Live that I've done talking about the topic and say, go watch it, make a comment, tell me what you think.
Tell me about online nutrition and what kind of resources do you tend to plug patients into? I mean, is there a specific diet that you recommend? Does it depend on the patient? How do you handle all the many differences between patients in recommending the right diet?
I'll be honest with you. All diets essentially work. It's being able to stick to it long term, and so it's a question of what's important to the patient. What's what culture, what foods are like part of essentially who you are, and how can we tweak them? But generally speaking, I tell patients as long as there's no allergies or aversions to certain foods. When I say aversions, I don't mean you don't like the way they feel, but more it's going to make you sick. Then I tell them, I just want you to splash more fresh fruits and vegetables into your diet. Whole foods. And so there's a link, it's fullplateliving.com, and it's a free online program. And it's actually very not intimidating.
Yeah.
It doesn't intimidate. Like it's a simple to this week, we're going to add more apples. So eat an apple before every meal. Before you know it, you've had 3 servings of fruits in the day. So it's like a process to work you up to eating more fiber. And studies have shown increased fiber helps with cholesterol, helps with weight loss, helps with diabetes, helps with a lot of things. So fresh fruits and veggies, however you can get them in. So that's one of the programs I tend to recommend. And I've realized the simpler we make it, the easier it is to do. So and I tell them, you don't need to, you can keep eating whatever you're eating. I don't want you to, but you can do that. Just add fresh fruits and vegetables. And I find that the more they add, the more they have to get rid of something.
Right. Yeah, fiber is filling. We understand that very often when you fill out the plate with those pieces, there's just less room for those other things that are less healthy and adding less benefit to the diet.
True.
That's great. Do you have special advice that you provide if someone has diabetes or another medical condition that has a big impact on their metabolism?
So similarly to as far as the fruits and the vegetables, and then I kind of explain the difference between complex and simple sugars. And they're like, oh, I don't eat tangerines or I don't eat fruit because it has sugar. I'm like, but you're eating bread and a whole lot of white rice. So I had to explain just because it's not sweet, like tasting does not mean it doesn't have high carbs. So a lot of times they're like, oh, I didn't know that. So some of them avoid any fruit that tastes sweet. And so and that's why in conjunction with a nutritionist or a health coach, I help partner because I realize it takes a whole village. So if you don't hear from me or you don't listen to it from me, maybe a health coach, maybe a nutritionist who's then able to say, based on your culture, you eat this, well, let's add more of this and less of this. So it's still made for them. Is key.
Yeah, I think that patient-specific approach is really huge, and the ability to work with a nutritionist can really make an impact.
Yes. Yes.
Very
yes,
good.
yes.
Very good.
Tell me more about what
Tell
about
me more about
hypertension? How would you work with
How would you work
patients
with
with hypertension to approach dietary
challenges?
So salt is a big one, and of course exercise, but salt, and sometimes like, oh, I don't add salt, but then we go into you eat out a lot, you don't have control over the
Yes.
salt, or addressing the taste buds issue, like, doc, what do you mean, man? If I don't have salt, that's like, I don't enjoy the food. Little hacks like when you're cooking, add the salt last, so you don't have to use as much, or add other flavor enhancers, your spices, little olive oil. Those things kind of add, because I'm a foodie. I enjoy eating nice tasting food, so I use a lot of spices. And so when you do that, you can augment the need for salt. And then there's certain foods that are actually known to help lower blood pressure. And I have patients try it in their wholesome form, not in pill or pellet form. So things like, beets and sweet potatoes, collard greens. So adding more of that to their diet without salt in it, because then, so those are things I tend to advise for those who have high blood pressure. And the truth is, same thing, more fiber. It's amazing how much just eating more plants actually make a big difference. And when patients stumble on it, even though we talk about it very often, they're like, yeah, doc, I noticed. And I'm like, that's what we've been talking about all along. And so it's almost like a prescription. Here's your medicine.
Uh-huh.
Here's how much you should exercise. And here are foods you're going to use as medicine. Just like to control your blood pressure, you have to take your medications, the pills. You got to eat these foods to help keep your blood pressure better controlled, and you feel better.
Mm-hmm.
It's not about my chart looking
Yeah.
pretty.
Yeah, it sounds like
You
this is
actually
really a
feel better.
conversation about dietary choices, what people want to eat, increasing the quality of their diet. I haven't heard you say anything about weight loss.
Okay, so weight loss is important, and instead of harping, and patients come to me and say, I want to lose weight, so we talk about the same
Yeah,
thing,
if they
exercise
want
and
to
diet.
lose.
Um, yeah, but as they eat better, they actually lose weight. Now, I try to gauge the appointment. Some people come to me upset by previous physicians because of the weight obsession, they say. And I would not be a good doctor if I don't address that. So I tell them, I know this is the first time I'm meeting you, that is a concern because you will feel better as you lose weight. But let's start with the fundamentals first. As they eat better, the weight falls off actually.
Fantastic.
The weight actually falls off. So maintaining a healthy weight is very important. And I tell patients it's not for you to look like a bobblehead doll,
Right.
real skinny, it's, I want you to get to the weight where you feel your best. And a gauge of that is you can go up and down the stairs without feeling like you ran a marathon.
Okay. I like that. Functional outcome.
Mhm.
Can you get up and down the stairs without feeling like you've really worked too hard?
Yes.
Excellent.
Yes.
I think that's great. It's really important for patients to have that collaborative relationship, I think, with their physician, and if you can discuss weight loss, but in a accepting way and in a way that's really positive towards just building the healthy behaviors. I know that has to really help your patient.
Yes. And one of the things I also realize is helping them build a community. I'm not going to be the only part of that community. Yes, I'm your physician, but we have links to a health coach. We have links to a nutritionist. We have links to physical therapy, chiropractor, and I advocate for everyone, particularly with chronic pain, to have a community. Sometimes you have to work hard for that community, but it's important that you have a support system ongoing so that you can reach out when there's a flare, just for maintenance, for continued encouragement through life. And so, working with a doctor that can help you do that is important. And like I said, sometimes you have to work hard. So even calling your insurance to advocate, like, what are resources that are available to me that is covered, that I can use to improve my quality of life.
Yes.
Or this is a service I think should be added to my plan because it helps in the long run save healthcare dollars. That's not really, that's important too. But there are ways that we can empower patients to also advocate for themselves. But a community is very, 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 very important. It's not only the physician, and we play a major role, but there are other support systems as well.
Now, for anyone watching, I don't know if you happen to follow Dr. Olabintan, but she's a very good storyteller. She likes to post anecdotes about times she's helped a patient, and a lot of times I like to hear an anecdote about some time that you've helped a patient with a problem, if you've helped somebody to live long and well, when you've made a difference. I'd love to hear one of your patient stories.
All right. The one that comes to mind first is a patient I met who came to see me having a panic attack. She was having them chronically. She had gone to the hospital, and a cardiologist had asked her to see me or establish care with me as a primary care doctor. And she, no specific triggers, it just tended to be anxious. So I would, give her medication, talk about ways to cope with stress, and assign her to a health coach, someone who would help kind of keep her accountable with some of the health changes she needed to make. Blood pressure control was definitely an issue, weight control as well, and she was near diabetic. 3 months in, she was consistent with the health coach. She was feeling better. She was taking her medicines. It was maybe 7 months later, I saw her. She had lost 20 pounds. She actually was contemplating a marathon.
What?
And she looked at me, she said, I have never thought of myself as someone who would do that. And she's like, it's who I'm becoming through the process. And that resonated with me because that's something that I've gotten to understand, that sometimes challenges and going through processes, who you become, that's actually the amazing thing. Not even that you've lost the weight or you've overcome this thing. And she said something to me. She's like, I wonder what else I can do.
Wow.
Wow. I wonder what else. Oh my God, she was glowing. And this is over a course of 9 months. I want to emphasize that, like, it's not like I'm a magician and just one day you just feel like that. It was a process, a series of processes. To see people come back and say, people have noticed I have more energy. I want to take on more, it's like, wow, it makes it all the nagging. Or I think sometimes I do feel like I'm like saying the same thing over and over again. But at one point they listened. So it was what keeps me going. Seeing little changes that may not mean so much, but to see that it actually affects so much is empowering. Yes.
And you're right, like, you don't always know which conversation is going to make an impact, right? Because these are like ongoing conversations that we have with our patients, how we can help and ways of support. And a lot of times if I'm talking to a patient about making a change, I have to fully acknowledge, hey, you're the one that's going to do the work, right? Like, I'm going to support you, I'm going to provide you resources, but really to accomplish the goal, I'm not going to do the work.
That is so true. And so when I see the results people are having, then I'm able to even share that. Of course, not to to the details, but like, I saw someone today who did this. You can do this, and it's encouraging to keep us do it over and over again, even though you feel like sometimes you can get the eye roll. Like, yeah, okay, I got you. I actually had a patient recently tell me that she was going to leave. That she actually wanted to leave, just she was sick. She came back, and I said, "What happened?" She said, "I told her to stop Dr. Pepper. That how could I tell her to do that?" And I was like, "I'm sorry. I didn't realize how much it meant to you. Let's trade it though, because you're diabetic. I mean." But we keep. I'm serious. She was upset. She was like, I was going to leave you, but I have a cold and I have to come in, and you're my doctor. So, but we'll keep doing it, because some days get like, oh, am I making a difference? But you see the patients come in and they're doing. You're like, you know what? I'll keep at it. One day, if it's through a Facebook Live like this, maybe if it's through a text, maybe it's an email or something. It would hit you at your pinpoint, and then you're able to make
able to hear it. I think that's really important. Those conversations ongoing. You don't know when it's going to make a difference, and when people are ready to hear. And look, the doctor-patient relationship requires a fit, right? We have to be able to build a collaborative relationship. And I think it seems to me that you come from a really positive place in working with your patients to be able to always come to a really encouraging place, even when things are challenging. How do you maintain that kind of mindset and outlook yourself?
It's so interesting. I share those tips even with my patients, and that's your self-care routine. I wouldn't have thought I would say
Yeah.
that because I'm like, man, self-care. But self-care doesn't have to be taking a time off. Your manicure, for me, it's waking up early enough to pray, to meditate, to exercise, and to plan my day, and to pray and speak what's possible. And so it's I can't pour out from an empty cup. I know that's a phrase, but I can only give what I have. And so that's important. My self-care, it helps my mental health, the things I listen to. I meditate on the Bible, and so and the gift for me as a physician, or the gift of me as a physician, is compassion. I know it's a gift, and so that's sourced by my faith. And so doing those things every day, and I tell patients, listening to something in the morning to encourage you, meditating, praying, exercise,
Yes.
those things feed my joy. And so that keeps me going.
Yes.
Yes.
And so it's coming from a place of joy and feeding the parts of you to feel joy, so you can pass on that positivity to others.
Yes, ma'am.
That's awesome. I think that it's so important, and you're right to have all this come across, not from a place of like trite self-care that we're going to solve all our problems with a bubble bath or with a manicure.
In fact, I find manicures, I get them done, but you see, half my nails are gone. Like I'm trying to do stuff, listen, and I'm like, I'm like, you guys are taking, like, I don't particularly enjoy it. I realize I need to be honest with myself. Yeah, no.
Yeah. Well,
no.
and nothing wrong with self. If that's your self-care,
Right,
go right ahead. But it's not mine either. Yeah. Well, I just love having you on here. It's been an absolute pleasure. Do you have health tips or anything else you'd like to share with our audience? I'm going to share your contact information here in the chat. So for my folks in Maryland, unfortunately for you, Dr. Olabintan is in Texas, but she's a wonderful lady and has a wonderful social media presence, and you should like, follow, and share because it's worth your time.
Thank you so much. Please don't forget, go for your checkups. Very important. Maintain a healthy weight, socialize. We talked about eating healthy, exercise. Mind what's on your mind too. Please empower your mind, because you know how you think is how you live. And connect with doctors like Dr. Sarah Merritt, who's all about helping patients live longer well, because that's very important to have a good doctor in your corner.
Yeah, living long and well, and that quality of life really resonates with our approach too.
Awesome.
Well, thank you. I would love to do this again sometime, but I really just appreciate you being here and having your smiling face, the joyful presence here in the morning. It's just going to uplift me for my day.
Awesome. Thank you so much, Dr. Sarah. My pleasure.
Yeah, you're welcome. Thanks for joining us here on Livestream Health Center. Please find us online, livestreamhealthcenter.com, for all your pain management needs, making pain management accessible, caring, patient-centric, and evidence-based.